Welcome back, Straight Talkers. Today I'm going to talk about the medication Risperidone so that you can be better informed when deciding whether or not to start this medication. By the time this video ends, you're going to know how the medication works, what it's used to treat, commonly used dosing strategies, potential side effects, how long you'll need to be on the medication, and how to stop taking the medication if you decide to come off of it. Make sure to stick around to the end of the video because I'm going to talk about the side effect that everyone asks about, gynecomastia, which is commonly referred to as man boobs by a lot of my patients. Risperidone was approved for medical use in the United States in 1993, and it is on the World Health Organization's list of essential medicines. It's the most frequently used atypical antipsychotic in children and adolescents. It's important to recognize that each medication typically has a generic name and a brand name, and doctors will often use these names interchangeably. So Risperidone is the generic name and Risperdal is the brand name. Now, how does this medication work? Risperidone is considered to be an atypical or second-generation antipsychotic, and it works by changing the amount of the neurotransmitters dopamine and serotonin in certain parts of the brain. In adults, Risperidone is FDA approved for the treatment of schizophrenia, bipolar mania, and mixed episodes, bipolar maintenance, and irritability symptoms in autism. In kids, it's also approved for schizophrenia in those 13 and older, bipolar mania and mixed episodes in those 10 and older, and irritability symptoms in autism in those 5 and older. It's commonly used off-label and can treat other conditions such as behavioral disturbances, impulse control disorders, and motor and vocal tics seen in Tourette's syndrome. Risperidone comes in tablet, liquid, disintegrating tablet, and injectable forms. It's usually taken once or twice per day, and dosing is generally between 1 to 8 milligrams daily, and it's approved for use at up to 16 milligrams daily orally. However, data suggests that the risks of extrapyramidal symptoms is increased at doses above 6 milligrams per day. In addition, the efficacy at these higher doses is questionable in some patients. If I'm using this medication in kids, I'll often start at an even lower dose to help reduce the risk of potential side effects. And my approach is always to start low and go slow, meaning that we start at a low dose and increase the dose gradually and slowly over time with the goal of finding the lowest effective dose. If the injectable form is being used, it's usually given once every 2 weeks when it's first started. And you'll also have to take the oral form for about 3 to 4 weeks until enough of the injectable medication builds up in the blood to start working. Once the medication is started, it usually takes 1 to 2 weeks to start seeing improvement in manic or psychotic symptoms. If being used to treat behavioral issues, it might take several weeks before you notice its full effects. If you're finding value in this video, make sure to hit that subscribe button so that you can be the first to know when new content comes out. So when looking at the common side effects, the top 5 that were reported by adult patients in schizophrenia clinical trials included anxiety, somnolence, Parkinsonism, dizziness, and indigestion. It's also worth mentioning that this medication has been associated with changes in body weight. In long-term, open-label trials, adolescent patients with autism or other psychotic disorders experienced an average increase of 7.5 kilograms, or around 16.5 pounds after 12 months of treatment with risperidone. The normal expected weight gain in someone this age, based on CDC data, is around 3 to 3.5 kilograms per year, or around 6.6 to 7.7 pounds per year. Another side effect that is unique to this medication is its potential to affect prolactin levels. Risperidone has been shown to elevate prolactin levels in kids, teens, and adults. In placebo-controlled trials of kids and teens with bipolar disorder and teens with schizophrenia, 82 to 87% of patients who received risperidone had elevated levels of prolactin compared to 3 to 7% of patients on the placebo form of treatment. The increases were often dose-dependent and generally greater in females than males. In addition, in clinical trials of 1,885 kids and teens, 0.8% experienced galactorrhea, or discharge from the breast, and 2.3% reported gynecomastia, which refers to breast enlargement. When looking at other more serious but less common side effects, it's worth noting that FDA has put warnings on all atypical antipsychotics about the increased risk of hyperglycemia, diabetes, and increased blood cholesterol and triglycerides when taking one of these medications. There's also a class warning for higher mortality rates in geriatric patients with dementia-related psychosis receiving atypical antipsychotics. Other rare side effects include tardive dyskinesia, neuroleptic malignant syndrome, orthostatic hypotension, and decreased white blood cells, neutrophils, or granulocytes in the blood. It's important to realize that taking multiple medications at the same time might cause one medication not to work as well, or lead to an increased likelihood of potential side effects. So you should always talk to your doctor or pharmacist before starting a new medication, and make sure your doctor has an up-to-date list of all the medications you're taking. This includes those that are prescribed to you in addition to those bought over the counter or the internet. When someone is put on risperidone, it's ultimately unknown exactly how long they'll need to be on it, because it's dependent on the condition being treated. Sometimes those with schizophrenia, they might need to be on this medication for years, while someone who's taking it for aggressive behaviors might only need to be on it for a few months until behavioral therapy starts to work. When deciding to come off of risperidone, please don't stop taking this medication without talking to your physician first, because they can help work with you to come up with a plan on how to stop the medication so that unwanted symptoms don't occur. Some people experience involuntary movements called withdrawal dyskinesias within the first few weeks of lowering the dose or stopping the medication. These typically go away, but I've seen them persist for a couple months in some patients following discontinuation of treatment. Stopping the medication suddenly can also lead to emotional disturbances such as irritability, nervousness, or moodiness, or even oppositional behaviors. Physical symptoms can include stomach aches, nausea, vomiting, diarrhea, sweating, or trouble sleeping. Make sure to let your physician know if these symptoms or any others start to occur when you try to come off of this medication, because there's different approaches that we can take to reduce these unwanted effects. Now head on over to the next video to find out more ways that you can live your best life.